coming to the histology, I'm just saying ahead of time, the confusing part is the type of epithelium lining each structure. That's the most confusing part. So make sure you learn the types of epithelium in each structure. In the testis, it's more like cuboidal epithelium that becomes sperms, and in the epididymis, you have pseudostratified cells, stereoseria, other structures. So the type of epithelium is where you will be really getting confused. So have a look at the slides more often, and also study the histology text. I think that will help you a lot. It takes some. What you're looking is the cross section taken through the seminiferous tubules. If this is the cross section of the testis, you're seeing all the seminiferous tubules that are closely adjoined to one another. So seminiferous tubules lined with more cuboidal cells, and you know all the other structures that I have shown. Let's look at them in more detail. They're identifiable. They're okay. Easy to identify. Here, you're looking at the wall of the seminiferous tubule. Near the basal region, when you see these dark cells, spermatogonia. And the relatively pale cells, you can see the really pale cells, they are the Sertoli cells. They are as long as the wall of the tubule. Sertoli cells. Not the best picture, but identified. Sertoli cell. I would say this is a Sertoli cell. Generally, the nucleus should be more triangular cross section, but it's okay. That looks like a Sertoli cell. This one is another Sertoli cell. So the basal cells that are dark, spermatogonia. Can you see these cells with a relatively larger nuclei? Spermatocytes. We don't know they are primary or secondary, but probably primary more when they are more close towards the bottom. Secondary spermatocytes probably, and when they go towards the lumen, you can see the spermatids. Right? And in the lumen, you can see the sperms. Here in the lumen you can see some sperms. I think at this mag it looks better. Spermatogonia, spermatocytes, spermatids in the lumen. You can see the sperms with their long tails. And here, in the basal region, you have the basement membrane that forms the blood testis barrier. You can see a blood vessel here. Here you have the interstitial cells or the Leydig cells in between the seminiferous tubules that produce testosterone. Okay, this is a section taken through a rat testis, and it's like a mature testis which is actively undergoing division. So when you look at an immature testis, you won't see all these divisions. In an immature testis, before puberty, you don't see all these structures. Any questions with this slide? Section taken through immature testis. You don't see any of the sperms or spermatogenesis, but you see lots and lots of connective tissue around. Immature testis. No active division, so no spermatocytes or spermatids or sperms. Immature testis. Next we look at the epididymis. Epididymis, I said it's a really long coiled tube. So because it's long and coiled and very convoluted, when you take a section, again it appears like circles, but it's all single tube. So epididymis, the type of epithelium, pseudostratified columnar epithelium. It's not ciliated, it's simply pseudostratified columnar epithelium. But the best way to identify the epididymis is when you look at these structures in the limb. You see all these fine hairy structures, they are actually called stereocilia. Stereocilia. Actually the word stereocilia, it's a misnomer because they are not cilia. They are more like branched microvilli. They are close to villi, but still they are called stereocilia. It's something like the cell membrane throws up into folds. That's called stereocilia. Stratified columnar cells, pseudostratified columnar cells, stereocilia. This is the best way to identify that this is epididymis. And again in the lumen, you might find some sperms. Here you are able to see lots of sperms in the lumen. And all these stereocilia will help in propulsion of the sperms. Any questions in this slide? next slide we are looking is vas deferens, the long tube that is outside the testis. The best way to identify vas deferens is looking at its wall. It has a really thick wall, 3 layers of smooth muscle in the wall, really thick wall with a really narrow lumen. Right? Really narrow lumen with a really thick wall. That's vas deferens. Okay, Anthony has written, I think this slide is there in your blackboard, but Anthony has modified it a little bit, like adding different types of epithelium in this slide. Epididymis, tall columnar cells or pseudostratified cells, but the giveaway is stereocetrium. Ductus deferens, pseudostratified columnar epithelium. That's what we were looking at. So this wall is pseudostratified columnar epithelium. And the seminal vesicles is again pseudostratified columnar epithelium. So generally, what the easy way to identify, to differentiate all these types of epithelium is generally, when you think of the urinary tract, what's the type of epithelium? Transitional epithelium, right? Urinary tract, it's generally transitional epithelium. When you think of the genital tract, it's more like columnar epithelium. So, tall columnar or pseudostratified columnar, again ductus deferens, pseudostratified columnar. Seminal vesicle, again that's part of, that's an axillary gland. That's also pseudostratified columnar. But the prostate, when you look at the prostate, it's kind of mixed. You can see tall columnar cells, you can also see some more cuboidal cells, that way. So I would say more on the genital tract, it's columnar. On the urinary tract, it's more transitional. When it comes here, it's pseudostratified columnar in the urethra, in the main penile urethra. And at the tip of the urethra, it's stratified squamous. Right? Any questions regarding types of epithelia? This is where you'll be getting confused, so just make sure you identify the different types of epithelia. Ductus deferens, pseudostratified columnar epithelium. It's not that clear, but the easy way to recognize is seeing the walls. Okay, you can look at the columnar cells. That's actually a single layer, but the nucleus that are placed in several levels, it appears stratified. Pseudostratified columnar epithelium. Ductus deferens. Now let's have a look at the prostatic urethra. So this is all the tissue of the prostate. What we are looking for is the urethra. You see this large space, this large white space, that's actually the urethra. This is all the urethra. Like I said, in page number 364 in Netter, there is a cross section taken to the prostate where you can see all the urethra that's thrown into folds. And depending on the need, the shape of the urethra changes when urine or semen is flowing. So this is the urethra. So if this is the prostatic urethra, what's the type of epithelium? Transition. Prostatic urethra is transition. Okay. I'll show you the figure again. So the part of urethra in the bladder, because it's close to the bladder, transitional epithelium. And prostate is really next to the bladder, so the part of urethra in the prostate, not the prostate, the prostatic urethra, the pink line, that's transitional. And the part of urethra in the pelvic diaphragm, the membranous urethra, is pseudostratified columnar. Right? Pseudostratified columnar. And when you come to the penile urethra, it's again pseudostratified columnar. But it only changes to stratified squamous in the tip or the glans penis. Transitional, entire length is pseudostratified columnar. At the tip, stratified squamous. Right? So this is all the substance of prostate around prostate tissue, and this is the prostatic urethra. We'll again look at prostate. There are other slides to look at the prostate. Better slides that show. Okay, here you are looking at okay, this is right section taken to the cross section taken to the penis. This is the penile urethra. So what's the tissue around the penile urethra? Is it corpus spongiosum or cavernous? Spongiosum. This is all spongiosum. So the other name for penile urethra is spongy urethra. So corpus spongiosum. So this is kind of an inverted U. So above the corpus spongiosum, you have two large spaces. One on side, another on the other side. Corpus cavernous. This is white space where blood can be filled. It also has some connective tissue, trabecular. Corpus cavernous. And the wall around, the tunica albuginea, it is the thick fascia, and the exterior you have the skin line. Right? Now we'll be looking at the glands apart from the main reproductive organs. First, let's have a look at the seminal vesicle. structure that you see is the seminal vesicle. Seminal vesicle is another axillary gland that contributes to the semen. Actually, the seminal vesicle is it's just like a simple tube that's again thrown into lots and lots of holes. So this is actually all one tube that's thrown into lots and lots of holes, and all these secretions are dumped into which structure? Ejaculatory duct. So seminal vesicle. And coming to the type of epithelium, again we are on the reproductive side, so pseudostratified columnar epithelium. It's all the single lumen that is thrown into folds. Seminal vesicle. And I would imagine seminal vesicles are something like, there are two glands behind the urinary bladder. They are like wings of the bladder. I would imagine something like wings of the bladder. Seminal vesicles. Nothing much special regarding this slide. And yeah, Anthony was saying like seminal vesicles, they produce spermatic secretions that are rich in flavins. Flavins, so flavonoids, they impart more yellow color to the semen. Maybe they help in identifying semen in crime scenes. They're easily detectable. And a UTI. Now we'll be looking at prostate. Prostate is a tubulo-alveolar gland. So the gland has lots and lots of tubules and alveoli. All these alveoli will produce secretions that are dumped into these tubules, and all these tubules will join to form, and all these secretions are dumped into the ejaculatory ducts. So tubulo-alveolar gland, but the best way to identify prostate is the interstitial tissue. You have all these tubulo-alveolar glands. Around these tubulo-alveolar glands, you have lots and lots of fibromuscular stroma. It's all fibrous, and there is also some smooth muscle in that. So around the tubules, you see lots and lots of fibromuscular stroma. This is actually section taken through a young prostate. So that's actively that has lots and lots of glands, and also actively producing secretions. And the best way to identify is looking at the fibromuscular stroma. Now to contrast this, I am putting another slide of prostate that is of an old person. So again, you can see lesser glands but more stroma, right? Because there is not much production of the semen. You have lesser glands but more stroma, and also older people. That's the reason, because they have more of this stroma. That's also a big risk factor for prostatic hypertrophy or prostate cancer. That's the third most common cancer in males. And another best way to identify prostate is looking at these secretions. You see these secretions inside these tubules. When we zoom it in, so again, these are all the fibromuscular stroma. You can see some smooth muscles, some connective tissue cells, and the glands. Like I said, the type of epithelial cells in the prostate, they are mixed. You can see columnar cells, you can see some cuboidal cells. But when you look at this secretion inside the glands, structure inside the gland. This structure is called corpora amylacea. Corpora amylacea. This is actually the dried up secretions of the prostate that have been impregnated with calcium. Because this process occurs over a period of time, you can see layering of these secretions. Right? Just like something like an onion rings. Corpora amylacea, the dried up secretions filled with calcium. Corpora amylacea. This is the epithelium, kind of mixed, and around the glands you see lots and lots of fibromuscular stroke. Any questions with these slides? So make sure to keep, to make sure to identify the important points, how to identify each slide. Prostate. We look at the corpora amylacea and fibromuscular stroke. When we look at the seminal vesicles, it's all thrown up into flow folds, just like a crumpled gland, but we don't see this much fibromuscular stroke, and it's relatively smaller gland. When you look at the penis, look for the corpus cavernosum and corpus spongiosum. When we look at the ductus deferens, a very narrow lumen but a very thick muscular wall. And the type of epithelium in the reproductive tract is generally pseudostratified columnary. When you look at the epididymis, pseudostratified columnar epithelium, but the giveaway is stereocilia. You can see nice stereocilia inside the lumen. When you look at the testis, several layers of developing cells, that is the seminiferous tubules, and you can also look at the sperms in the lumen. That's it for the histology. Next week we'll be dealing with the female reproductive system, and we'll also show you the cat.